I'm Tiana and I'm here with
Pat Conkling.
and we're going to get to know her a little better. All right, so tell me a little bit about what you do.
Well, I started my professional career long ago in nursing, and I had a private practice in family practice for about 20 years. But in my practice, I did a lot of trigger point management, and that is in the whole category of dry needling and trigger point therapy.
Okay, very cool. And what got you interested in dry needling?
I think like with most of us, our own personal experience has a lot to do with informing how we see things and how we react to problems, solve problems. So I'm I'm one of those people who experiences things that I also encounter clinically. So for myself, I sought treatment for some of my chronic muscle dysfunction, and this was a therapy that helped me more than others.
You did mention dry needling and trigger point. What is
There's a little bit of difference between that. Trigger point therapy is a broader category, and that would have to do with any technique to address trigger points. But with dry needling, there's no medication involved. It is a solid needle, but super fine, the same thickness monofilament as in acupuncture.
What are some of the benefits and risks?
So with trigger point therapy using dry needling, the benefit is that you can get such rapid resolution. It can be same day.
Oh, that's amazing.
So other benefits of that is, again, there's no medication involved. It's minimally invasive and specifically to those muscles, and there's no downtime, I would say. You will typically see some soreness, especially if electric stimulation is used with the needles, and that soreness is related to the muscle fibers being released, which allows some of that lactic acid and some of the byproducts of constant contraction to be circulated out. So there's as if you had been in a tough workout or a prolonged muscle work situation. That kind of soreness for a day or two is not surprising, but other than that, there's no real adverse effects.
Well, we love that. So if it hurts,
it's good.
It's good, yeah. Okay, very good. What are some of the indications?
Dry needling, you can address more of the muscle tissue, including some of the attachments, like the tendon or the ligament associated with that muscle group. The other advantages of dry needling over trigger point injection is it's specifically indicated for releasing and improving inflammation, releasing and improving dysfunction around a joint, improving the circulation to that point of injury such that your micro circulation exchange of nutrients, gas, carbon dioxide, oxygen is improved by what's called micro trauma. So now risks associated with this is bruising, as you might suppose. Anything that can poke you can bruise you. Some soreness. Once in a while there have been reports of some transient dizziness, and that would be, again, anything that's poking through the skin can trigger a vasovagal type response where people feel woozy or dizzy for a minute, but that's very transient.
Okay, and who do you think would benefit the most from these types of therapies?
I think that's a big group because it could be young people to quite old people. It can be people who are at optimal health as well as people who are struggling with their health. So it's a very large group. The primary indication being muscle pain, soreness, dysfunction, and stiffness or what I would call a poor adaptive response to whatever it is we're trying to accomplish.
Cool. Very cool. And lastly, this one's not on here, what would you say to someone who's never had a dry needling? What would you say to encourage them? Like,
okay, so if I were trying to encourage someone to consider dry needling, what I would tell them is this is minimally invasive, relatively short duration of treatment, and can be done fairly often to help resolve problems with essentially no downtime.
very cool. And lastly, for our patients here, when are you available?
Okay. I'm very grateful to have this opportunity to work with the patients at Eight Flags. I'm here in the office and using treatment rooms here at this building on Monday afternoons.
Perfect.